Relief for the regions, as the city and country are once again divided.
We've always said that restrictions shouldn't be in place for a moment longer than is required.
Year 12 student Amelia Bailey is celebrating, along with many of her Bendigo classmates, that the lockdown lifts tonight outside Melbourne and she can get back to school.
Whilst it is a surprise, it's a nice one because I definitely thought that this was going to be much longer.
But some students on the border aren't feeling as relieved.
I think it's a bit hard to get excited about returning to school now because the last lockdown was only a couple of weeks ago.
After no cases in regional Victoria from the latest outbreak, hospitality and retail will also reopen, but businesses must check customers' IDs.
There's no point going to regional Victoria. You won't be able to buy so much as a litre of milk without establishing that you're from regional Victoria.
If they haven't got ID, we don't let them in, but then they go around the corner and they get served around there. So come on, enforce the rules or don't have the rule. It's easy.
While there won't be a ring of steel, police have warned Melburnians who try to sneak into the regions they'll face a $5,000 fine.
We will be on the main arterial roads and also covering the back roads.
So we're calling on the government to revise its definition of metropolitan Melbourne. Now, the Mornington Peninsula should be treated the same as the Bellarine Peninsula.
Victoria recorded 11 new cases today. 7 of those are linked to the CS Shopping Centre in Caroline Springs. Anyone who was there between July 27 and August 5th must get tested immediately.
We are quite concerned about a number of positive cases we've now identified from different stores associated with different movements in the shopping centre.
Also of concern, a positive case that visited the Maternity Assessment Centre at the Joan Kirner Hospital on Friday. 27 medical staff are now isolating.
It's concerning whenever this gets into a public hospital or any hospital setting, but I think Victorians can be confident that we take this very seriously.
Christ the Priest Primary in Caroline Springs is the latest school affected by the outbreak. This childcare centre in the same suburb is a Tier 1 site, as the number of exposure sites ballooned to more than 200. A decision on whether Melbourne's lockdown will be extended is still days away, with the Premier saying that'll be decided as close to Thursday as possible. Any lockdown extension will be guided by how long it'll take for all new cases to have been in isolation for their entire infectious period. Bridget Rollison, ABC News, Melbourne.
Drive in, drive out.
It's just so easy, not exposed to anybody or anything.
Melton's new drive-through vaccination site is officially open and picking up momentum.
We're going to do about 5,000 cars a week through here.
As new sites open and eligibility widens, Victorians are responding.
We've had around 15,000 appointments have been made. Extra appointments have been made just since yesterday.
Driving the increase are under 40s like Arjun, who from today can book into some state-run vaccination hubs for AstraZeneca.
I just went online last night after I saw the news and then pretty much went to the Victorian government's website, took a couple of minutes and it was all done. If you're okay with it, you just go ahead and they just quickly do it. It doesn't take too long, it's painless, so it's pretty quick.
With bookings for under 40s at state-run hubs filling up quickly, and with Melbourne in lockdown number 6, some young people are heading to local GP clinics for the jab.
We've had a massive spike in interest for the AstraZeneca vaccine for the younger demographic.
People wanting AstraZeneca still need to talk to a GP because of the risk of blood clots.
The risk from the AstraZeneca vaccine is remote, okay, and we talk to people about that every day. The risk is so low, it's a very safe vaccine.
And the benefits of the vaccine are high.
Everybody just needs to get vaccinated.
If the state's current rollout continues at the same pace, 70% of Victorians will have had their first dose administered by October 28 and 80% by November 29. In New South Wales, where things are moving a bit more quickly, 70% of people will have had their first dose administered by September 13 and 80% just a few days later. But this is all dependent on vaccine supply and demand staying the same. Oliver Gordon, ABC News, Melbourne.